class is histamine 2 receptor antagonist, also known as H2 blockers. So how does this medication work? First, it suppresses your secretion of gastric acid. So guess what? It decreases the amount of gastric acid that is produced in the stomach. It alleviates symptoms of heartburn and assists in preventing complications for peptic ulcer disease. It prevents stress ulcers and reduces the reoccurrence of ulcers. And it promotes healing in patients with GERD. So the drug names that are in this class are the DINES. So that is the way to remember. They all end in DINES. So the first one is cimetidine, famotidine, nicetidine, and ranitidine. So the best way to remember these medications, they end in DINES. So who should take this medication? Patients with GERD, peptic ulcer disease, GI bleeding, and stress ulcer prophylaxis. So side effects for these medications. So even though they're in the same class, they are different medications and they can cause different side effects. So for our famotidine, the most common side effect is headaches. For our cimetidine, side effects are rare, but dizziness, rashes, headaches, and gynecomastia may occur. With our ranitidine, the most common side effect is headache. And with our nicetidine, side effects are rare. So we're going to talk about our cimetidine. This one can be administered orally and through IM injection or IV. Anytime something is administered IM, you need to know your intramuscular injection sites. All right, so food reduces the rate of absorption. So if taken orally with meals, absorption will be slow. So this medicine will take longer to get to working. If it's given IV, it can cause hypotension and dysrhythmias. So if I know that a medication can drop a patient's blood pressure, and I know a medication can cause their heart to start acting funny, I want to make sure that I have a baseline blood pressure. I want to make sure that I'm checking their blood pressure during the infusion. And I want to make sure after the infusion is complete, I want to check their blood pressure. Also, if that patient is not on a heart monitor, I want to call the doctor to get an order. Because how are we going to know if the patient is having dysrhythmia if they're not on a heart monitor? All right. So some drug interactions that can happen with cimetidine is antacids. So antacids decrease the absorption of the cimetidine. So you want to make sure that they are administered at least 1 hour apart. And I'm going to skip that one, and then I'm going to go to the next drug, which is warfarin. Warfarin is an anticoagulant, right? So if they're on a anticoagulant warfarin and they're on cimetidine, it can cause you to be at risk to bleed more easily. So it says that cimetidine and warfarin given together can have an increased anticoagulant effect, which puts you at a risk for bleeding even more. So going back up, so cimetidine passes the blood-brain barrier and the nervous system. So side effects and adverse effects can happen. That's from the central nervous side. So it may cause mental confusion, agitation, psychosis, depression, anxiety, and disorientation. All right. So this one is all for cimetidine, not for the H2 blockers in general, but just for this one medication. Who shouldn't take this medication? Patients with any known allergies. And also, it should be used in caution in patients with an impaired renal, which is kidney, or hepatic, which is liver function. All right, so you need to know the renal part, which is your kidneys, right? So that is your BUN and your creatinine lab values. Your hepatic, which is your liver, which is your ALT, and your AST. So you want to use it in caution with these patients because it is metabolized by the liver and it is filtered by the kidneys. Okay? So administration of this medication, you want to take them 1 to 2 hours before your antacid. And also, smoking decreases the effectiveness of the medication. So you want to tell your patient, hey, you may want to stop smoking because smoking is going to make this medication not work as good as it could. So, NCLEX practice question. So the nurse determines the client needs further instruction on cimetidine if which statements were made. Select all that apply. Number 1, I will take the cimetidine with my meals. Number 2, I'll know the medication is working if my diarrhea stops. Number 3, my episodes of heartburn will decrease if the medication is effective. Number 4, taking the cimetidine with the antacid will increase its effectiveness. 5, I will notify my primary healthcare provider if I become depressed or anxious. 6, some of my blood levels will need to be monitored closely. Give you guys a second. All right, let's go over the answers. All right, so your answers are 1, 2, and 4. I encourage you guys to always read the rationale. That's why with this one, I posted the paragraph rationale, because even if you get the question correct, always read the rationale. Always